We're seeing that climate change risks on health and the threats to our health and well-being are growing and are reaching new record high levels across most of the indicators in which we're monitoring them. And we're also seeing a world that is kind of backtracking on the necessary climate actions and on previous commitments that would have protected people's health and people's well-being. So very, very concerning findings in this year's report. We're seeing, for example, people around the world being exposed to an unprecedented number of heatwave days that threaten life and threaten particularly elderly populations, those with underlying health conditions. And we're seeing that heat-related mortality reached more than 500,000 people in 2021. That is the latest year that we have data for. We're also seeing the spread of infectious diseases growing. We're seeing record high levels of risk for the transmission of diseases like dengue, for which we have also seen record high number of cases in recent years that we know climate change was partially at least fueling. Despite the fact that we're seeing such a falling engagement from political leaders, what we're also seeing is that sometimes it is the local governments that are still taking the lead and the ones that are most in contact with local communities that are holding the efforts for climate action to be taken forward. And we're seeing things like extreme weather events becoming more frequent and more deadly. We have new data this year showing that we had more than 150,000 deaths related to wildfire exposure per year, wildfire smoke exposure per year. So the death toll of climate change is rapidly growing, and that is particularly concerning. The other thing that we need to see is obviously a reduction of greenhouse gas emissions. We know that our health systems are already struggling with the current level of heating at about 1.3, 1.4 mean global heating on average. What would happen if we go down the current line where heating is expected to be at least 2.7, if not more, with the backtracking of commitments? It's very unlikely our health systems will be able to cope. We're reaching what we call the limits to adaptation. How much threats from climate change can we actually adapt to? So COP offers an opportunity to cement international efforts and international diplomacy. When it comes to health, we know that health is defined not only locally, but globally. So we need well-articulated global efforts to ensure that, firstly, we are adapting to climate change, and we're supporting all countries in strengthening our health systems to give a good response and reduce the threat of infectious disease transmission and other adverse health impacts of climate change through good health system adaptation. That needs funding, that needs knowledge, and that needs cooperation.